We know that mastectomy is an operation where the breast is completely removed. But do we know what the truth about mastectomy for breast cancer treatment is, and if there is a myth about its effectiveness or efficacy as a treatment option? Let's uncover this matter and what impact it might have on women with early-stage breast cancer. Let us firstly examine what is meant by the word myth. The Cambridge Dictionary defines a myth as a commonly believed but false idea. So how does this relate to mastectomy? What is a common belief about mastectomy that is false and not supported by evidence? I hope that by the end of this video, you will see the presence of such a myth and the data that will dispel it. In order to prove what is untrue, we will first need to uncover the evidence about mastectomy and the alternatives for the surgical treatment of breast cancer. In January of 1991, the National Institute of Health issued this consensus statement about the roles of mastectomy and breast conservation in the treatment of early-stage breast cancer. It was declared that breast conservation treatment is appropriate therapy for the majority of women with stage 1 and 2 breast cancer and is preferable because it provides survival rates equivalent to those of total mastectomy while preserving the breast. The details of how this professional body in the United States came to this conclusion is discussed in other videos on this channel. Suffice to say, it was through rigorous research that this conclusion was arrived at. Breast conservation treatment is an alternative to mastectomy for the treatment of breast cancer. As the name suggests, it is a surgical operation which conserves or preserves the healthy, uninvolved part of the breast after full removal of the cancer with a rim of normal tissue around it. In other words, when breast conservation treatment or BCT is performed, the entire breast is not removed. In spite of the effort and detailed analysis that was performed to introduce a less traumatic form of treatment with similar survival outcomes, this team of doctors reported in December 1991 that there was an underutilization of breast-conserving surgery and radiation therapy among women with stage 1 or 2 breast cancer. There was a peak in the use of breast-conserving surgery, or BCS, in 1985, but this was followed by a decline subsequently. It was estimated that 3/4 of the women diagnosed with breast cancer in 1991 will have stage 1 or stage 2 disease. It is likely to be a higher number today. At that time, this group of researchers had already sounded the need for a change so that women can benefit and suggested ways to promote a shift towards increasing BCS. However, it appeared that the efforts to promote BCS or lumpectomy was in vain. For in 2009, this group of doctors from Florida reported a rise in the rates of mastectomy, and the percentage of women who underwent mastectomy exceeded those who had lumpectomy from 2008 onwards. This was in spite of emerging evidence in 2007 that women who underwent breast conservation treatment, or BCT, had improved survival outcomes. Here is another study published in 2014 that also reported improved survival rates with breast conservation when compared with mastectomy. There were scores of other studies subsequent to these which also demonstrated similar results. Despite strong evidence supporting the use of breast conservation surgery plus radiotherapy, the majority of women continue to be treated with mastectomy. It is unfortunate that this was the case more than 2 decades after the consensus statement by the National Institute of Health in 1991. This led Dr. Beryl McCormick from Memorial Sloan Kettering Cancer Center in New York to propose the existence of the mastectomy myth. This is yet another study which reported improved survival with breast-conserving surgery plus radiotherapy. With this, the issue of encouraging women to choose BCT became more urgent. Because of this mismatch of scientific evidence and clinical practice, Dr. McCormick here chose to emphasize that a myth supporting an aggressive surgical procedure, in this case mastectomy, which is less effective for breast cancer cure than is breast conservation surgery plus radiotherapy, should be recognized as an untrue and harmful belief. The evidence is emphatic, and she exhorts those of us who are responsible for the treatment of women with early-stage breast cancer to communicate this message clearly to our patients. Unfortunately, our efforts to communicate this message clearly to our patients is often thwarted by other sources. For example, this news article, which is freely available to the public, published nearly 9 years after Dr. McCormick's emphatic statement, quotes a doctor saying that a clinic's latest innovation is a procedure referred to as endoscopic breast surgery, which involves keyhole mastectomy. A mastectomy is a mastectomy regardless of the technique used to achieve it, and in light of Dr. McCormick's article, one may wonder if this constitutes a regression in medicine. Furthermore, the first patient to undergo this operation had stage 1 breast cancer. Recalling this 2016 study that we highlighted earlier, it is clear that breast-conserving surgery plus radiotherapy showed improved 10-year overall and relative survival compared with mastectomy in early breast cancer. But particularly, 10-year distant metastasis-free survival was improved with breast-conserving surgery plus radiotherapy compared with mastectomy in the T1N0 subgroup, which constitutes stage 1 breast cancer. So it is perplexing that the media article alluded to in the previous slide stated that doctors continue to recommend and perform mastectomy for stage 1 breast cancer. Unfortunately, therefore, it appears that providing evidence-based education and treatment may be a Sisyphean task, and the mastectomy myth may persist to the detriment of women with early-stage breast cancer. But we at Just Medicine will double our efforts to communicate the message of breast conservation treatment to all and urge women not to fall for the belief that mastectomy offers better survival outcomes than any BCT. It is hoped that having stayed until the end of this video, you would be more familiar with the evidence that has been accumulating since 2007, which robustly supports that breast-conserving surgery plus radiotherapy results in better cure rates than mastectomy in early breast cancer. There are clinical circumstances where this may not be possible, and women are advised to see their doctor for appropriate treatment planning. Still, it is our hope that wherever possible, women will choose to have breast conservation treatment if they are eligible rather than mastectomy to experience the best chance of breast cancer cure. In our other videos, we will discuss the history of breast conservation treatment, the countries which have reported the outcomes of surgical therapy, and more recently, the plausible reasons why breast conservation treatment, or BCT, results in better survival outcomes. Stay tuned and see you in the next video.